We will now discuss the most important topic, which are often ignored, but vitamins are vitamins are the vitamins are not synthesized in body except vitamin D. Vitamin D is synthesized by the body, and 60 milligram of tryptophan give rise to 1 milligram of other group which is synthesized in our body by intestinal flora are vitamin K, vitamin B, and vitamin P. तो के फॉर विटामिन के, मेलाक्विनॉन, बी से बायोटीन एंड पी से पेंटाथोनिक एसिड। ये बॉडी के अंदर बनते हैं इन इंटेस्टाइनल फ्लोरा। सो हम लोग क्या कैसे याद रखेंगे, आई एन आई एन आई एन इन बॉडी इंटेस्टाइनल फ्लोरा, मेलाक्विनॉन, बायोटीन, आई एन, पेंटाथोनिक एसिड, पी। तो के बी पी इंटेस्टाइनल फ्लोरा, इंटेस्टाइनल बॉडी। देन प्रोलॉग एंटीबायोटिक यूज, विटामिन के deficiency occurs and intestinal flora is disturbed. Vitamin classification of vitamin: fat soluble and water soluble. Fat soluble A, D, E, K, and water soluble is B and C. The A, D, E, K are absorbed by fat and require chylomicron. But water soluble, what happens, we eat one day and then it get excreted in urine, sweat, etc. Fat soluble vitamin will not be absorbed in cystic fibrosis, malabsorption of fat due to fat soluble vitamin. um, in cystic fibrosis, which can be there, ADEK, because fat soluble will not be absorbed in cystic fibrosis. So B and C will be absorbed. Water soluble vitamin B and C. First we will study about vitamin B1. B1 is thiamine pyrophosphate, and we found that vitamin 1 is cofactor for transketolase, so it is very important point. HMP shunt, oxidative decarboxylation, transketolase enzyme is used in HMP shunt, and in HMP shunt no ATP is produced. So transketolase is cofactor for vitamin B1 deficiency is there. The transketolase in vitamin in if the in body RBC transketolase activity is decreased. So to detect body B1, we check transketolase activity in RBC. See, so simple. Thiamine is present in allunar layer of grain, that is chakor जो होता है. And when we do polishing of the grain, this is lost by polishing. So choker, we should use choker's grain, choker wali roti. Why? Because it will have thiamine sufficient. Parboiling attach the allunar layer to the grain, so it is not lost by parboiling. So thiamine is lost by polishing, but not lost by parboiling. And then vitamin B2, we have beriberi and wet beriberi. B1 deficiency, it can lead to dry beriberi and wet beriberi. In wet beriberi, wet blood is wet, we can say. So high output cardiac failure. So we can get history of lactic acidosis, alcohol consumption. Dry beriberi will be like symmetric motor and sensory neuropathy, tenderness and cramp. Alcohol use, we have alcohol use will lead to wernicke's encephalopathy. So absorption of vitamin B1 decreases. Then the wernicke's encephalopathy take place, in which symptoms are GOA, global confusion, ophthalmoplegia, ataxia, mammillary body lesion, ophthalmoplegia, ataxia. So GOA can be mnemonic, global confusion, ophthalmia, and ataxia.